Good morning and good afternoon. Welcome back to the Weekend Wellness Hour show. It's a new year, and we are going to start off with having a returning guest, Leah Benson, who's a psychotherapist out of Florida, who's going to be joining us today to talk about ketamine and its use for helping with severe depression and other conditions that she mentioned. So we've had Leah on before, but we had talked a little bit on a different topic related to mental health. So we're shifting now to look at ketamine, and thanks for coming back on with us today, Leah.
Absolutely. Thanks for having me. Good to be here.
Wonderful. And so many people may not be familiar with this use of ketamine for helping people, but how did you actually get into it? Because, there's a journey for you, I imagine, for that as well.
Sure, absolutely. So I'll just, for those who remember, and it's a repeat, but so I'm a body-based psychotherapist, and in my practice, the way that I ended up moving in the direction of ketamine assisted psychotherapy or ketamine integration therapy was that I had a couple of patients ask me, "What do you know about ketamine for depression?" Yeah, and I was like, "Well, I don't know much." This was back in 2018. And I didn't know much, and so, but because people asked, I thought, well, let's look.
Yeah.
So I did, just vaguely, and then I had a patient ask me about MDMA assisted psychotherapy, who went to Colorado to have a session, and so I started investigating, being a part of the MAPS, which is the Multidisciplinary Association for Psychedelic Studies. Which is they do research on psychedelic assisted psychotherapy. And, I thought maybe I'll start a site for the trials, they're doing FDA trials. And I looked into that. Wow, no way. I don't have that kind of, to set something like that. I had an MD friend who was gonna, get who had the DEA number, all that stuff, but it wasn't to be. So in the beginning of the pandemic, I received an email from a company called My Ketamine Home, which is an oral ketamine dosing program out of Miami. And they said, "How would you like to be part of our Keta counselor network?" And yeah, so I was like, absolutely, sign me up, and I had to talk with them, and I took said, it's, I have a funny feeling that, like, I'd feel weird suggesting that people do this if I didn't know what I was suggesting that they do. Mm-hmm. So I also had my own, ketamine experiences. And so that's really it. That's the story of how I got involved. And that was about 2 years ago, almost 2 years ago at this point. And that is how I got into it, and I could tell you so much more, but that's the beginning.
Okay.
Yeah.
So for people who aren't familiar with ketamine, what is it exactly?
Okay, so ketamine is an anesthetic. It is used in surgery all over the world, has been used since the 50s. It was used as what was called a buddy drug in the Vietnam War, for let's say a soldier's injured, and he needs to be returned to their home base or what have you. These guys would carry syringes of ketamine, and they could dose each other if necessary to get a guy back without too much pain. So it's safe enough to send out in the field with soldiers, in essence. So it's an anesthetic, not used at anesthetic doses. So at a lower dose, it's a dissociative molecule, dissociative anesthetic, which, I don't need to get too much into what that means, but that is what ketamine is. It's I'll elaborate on, people might have heard of it as a horse tranquilizer or Special K, or, these are the things people have heard about ketamine, or that people go into K holes. These are the sort of misconceptions. And I mean, so that's a quick version of what ketamine is and what you might have heard of it as.
Okay. And so when you're talking about dissociation, when it's used in a lesser dose, basically you're kind of trying to separate your mind and body and maybe separate yourself from a trauma? Is that?
Well, that sure, absolutely. One of the things, so specifically around that, so ketamine, unlike a sort of what's considered a classic or traditional psychedelic, like psilocybin or LSD or MDMA, which is also not particularly traditional. But anyway, is that with ketamine, because it's an anesthetic, there is it's sort of like the motor system is turned off in the body. So when you think about an old trauma, it's into your mind during the dreamlike state that you get into under this dose of ketamine, you don't have the uncomfortable charge that comes along with that memory. So it allows you to look at it with the charge dissociated.
Got it. Makes
Yeah.
sense. Which goes really well with what you do with looking at how the mind body connection is. So this helps to explore that connection and see how people might have just some disturbances in that connection and where they may be off. I can see that.
Yeah.
That's great. Well, that's
Yeah.
wonderful. So is it used only for severe depression, or is it used for other conditions as well when in terms of the mental health sphere?
Sure. I would say that in the recent past, in the last 20 years, it began, obviously it was used in the past, but let's just say 20 years ago, it started to be used for what is called treatment-resistant depression. And so there was a protocol of 6 IV doses given to people who had gone through at least 2 different depression medications or treatments and that did not work. So that's where it began. And from there, it's really branched out into depression, anxiety, PTSD, really any, well, I don't want to say any mental health disorder. I mean, there are, let's say, it's not necessarily recommended for people who are manic or people who have schizophrenic symptoms. But in general, it is used very widely for a lot of different mental health difficulties. Yeah.
Is there any reason that you can explain why it wouldn't be used for schizophrenia or manic disorders? Is that too much of a shift, or they're not sure yet why it's not really used for that?
Well, I want to say, the truth is that it probably is being used in certain areas for that. It's just, it's just that there are not, I would say, there are not the trials that indicate it technically as as something to be done, broad spectrum with those disorders.
Got it. So maybe in the future.
Exactly.
Something. Okay. So when it's used for something like depression, how does that process work, and what does the drug do to a person's mind, body, chemistry, all that?
Sure. So basically, a lot of psychedelics work on a receptor called the 5-HT2A receptor, which is a serotonin receptor. The ketamine works on a receptor that it has to do with glutamate, which is, you probably know, is an excitatory neurotransmitter, as opposed to like GABA, which is a more calming neurotransmitter, or even I think serotonin is more calming transmitter. Anyway, I don't want to get too technical on that because that's not really my area, but I know that, so in what it does with the glutamate receptors and the brain-derived neurotropic factor, which facilitates neuroplasticity, what's happening is that your brain is primed to create more connections in its cells and to create neurons and synapses. So the ketamine is priming your brain to build and facilitate the production of new connections. And with new connections, you can take new perspective. You see yourself in a new way, which is a new perspective. But things that felt overwhelming just don't seem, subjectively don't seem overwhelming anymore. And there is a sort of, again, like the stories that are going on can be taken from a new perspective. Things that were frightening to look at, that were sort of a burden on the body, are now less of a burden, can be looked at and sort of, really gazed at without the charge that generally comes by looking at these things, which then, depending on what the depression is about, really lifts off the burden that a person carries around, can often carry around very shortly after. I mean, ketamine is known to have effect after one session. The protocol began as a 6-session protocol, but often people find relief that they haven't had in years, like 10 years, 20 years. They will experience relief after one session.
Wow. And so when they go through that one session, they can have such a dramatic change that maybe they don't need more, or maybe they don't need that many. Is that the case?
That's true. It is recommended to just go ahead and continue with the 6 doses. Although if you feel, again, it's like there's no there's no requirement, that there's no necessity particularly. I mean, the great thing about ketamine is that it's, there's no harm done, really. There's if you have high blood pressure, you need to be monitored. But other than that, it's so safe that, so that's sort of an aside from your question. There's no need to go on with it if you feel like you've gotten what you need.
Oh, that's wonderful. And is there any addictive quality to it?
Well, there's debate about that. Technically, no. I mean, I would say technically no. There are people who have a tendency to be sort of attached to, but this is in all the things I've read, they're very infrequent anecdotal incidences of it's not a dependent. It does not create a dependence. Let's just say that.
Okay. Oh, that's great. And so if I would need it more than one time, am I doing it on a weekly basis, or is this something where you go through it with the ketamine, you go through the processes in your mind and brain, and do you need a lot of time to recover from that before you go on to the next one, or is everyone individual?
Right. So with ketamine, the 6-dose protocol is suggested to be done once a week or twice a week, right? The reality is, that's the protocol. Although, and some people that suffices for, a month. Some people it suffices for 6 months. And I think an important thing before I go on is ketamine is a catalyst. So it has effect in and of itself, but it is really a catalyst in its facilitation of neuroplasticity for new thinking, new movement, new learning, new perspective that goes on. So that kind of retracing to the question is, how, is it once you're done, or you do it repeatedly? If it is, because really it's I don't want to say it's a Wild West, but because they're not, no one sticks to a specific protocol. There is no protocol particularly. So often it's done with these 6 sessions with a follow-up once a month. Sometimes it's done there. I've even seen low dose protocols where there's a 21-day low dose, and after 21 days, every day you go to every other day. But I'm really talking more about the psychedelic doses, higher doses, and those are done really they start with a sort of 6-dose protocol. Now, for the company that I initially was contacted by in 2020, they have an initial 6-dose protocol, and then they have a follow-up sort of protocol. That's sort of their reset program, and then they have a more long-term new you, and that's all. That's I think it's 12 doses at one after you've and some people do those once a month. Some people do them regularly once a week. It really depends on where they're at. I mean, you're not really on your own on this, because you have a client success guide with those guys, or you have a therapist, and you're working with your therapist, and the reality is, this takes a day. The process.
Okay.
And this kind of gets into different ways to deliver, right? And so it takes a day, whether you go and have an IV or have an oral dose or have an intramuscular injection. But it's so I'm sort of going on. So I feel like I should stop and let you ask a question, or should I just go
No,
on?
that's good, because it's good because I was going to ask you, what is an experience like? I mean,
Okay.
I've never done anything like this, so I'm sure there's many other people who have no idea what happened.
Yes. Okay, great. So there are a few different ways to deliver the ketamine. And unless you're doing low dose, which I'm not going to talk about, but the kind of higher psychedelic doses come in drip IV, which is a 40-minute or an hour-long process. Bolus IV, which is about a half-hour process. It's a 10-minute deep experience, and you're kind of able to walk out in about a half hour, 40 minutes.
Wow.
Yeah. There is intramuscular, which I don't have any experience with, but I know a guy who's been doing it, I think, for 30 years, does oral and an intramuscular dosing. And then there's oral dosing. And intramuscular is a shorter period. It's about 40 minutes to an hour. And the oral dosing, it's anywhere from an hour to 2 hours, depending on how big the dose is and how much you've actually swallowed, as opposed to dissolving under your tongue, because that's how it's done. And in each of those, in essence, you go into a for whatever length of time. There is this psychedelic part of the experience, and then a sort of, we'll say non-sleep, deep rest kind of a period of time. And then there is this 24 to 48 hours afterward that are really prime time for you to tune that neuron and synapse growth that has been facilitated by the ketamine. And that's where you speak to your therapist, you journal, you sing, you go on barefoot walks, you listen to inspiring things, you create, you meditate, whatever it is. You want to tune that neuron and synapse growth, because that's how you change. That's how you get out of the rigid patterns and of anxiety or depression or panic or spinning in your head that has been going on.
Interesting. And so, do you work with people during that 24 to 40 hours in addition to monitoring them when they're in that critical first stage, whether it's 30 minutes to 2 hours? Do you do both of that?
Sure. And that really, so again, it's sometimes I work with people while they are under their dose.
Okay.
Sometimes I'm with them. Although obviously there are times where they're so far into the experience that we're not communicating.
Okay.
But there are good portions of that time where we can actually kind of do therapeutic work. Not everyone has me with them, especially people who are doing, a clinic where I can't come, or if they've decided to do their home dose, on a Friday evening, So yeah, absolutely. And so I have sat with people virtually online. There will come a time when I'm going to be having them in my office while they are having their experience in person. But often what it is that, in that 24 to 48 hours afterwards, I have a session with them. And it doesn't really matter whether it's in my office or virtually, just so that we're having a session kind of, reflecting and, talking about what came to mind. It's really about integrating the insights that came during the experience. And, so the whole experience sort of stirs the pot. And so it really just, in that therapy is a kind of person-to-person journaling type experience, of being self-aware and practicing, thinking about what's going on, that we are doing that. In optimally in that 24 to 48 hours afterward.
Okay. And then when someone is going through, when they're actually taking the dose, is there chances of getting sick? Do they need to have someone in the room with them? No operating vehicles, like those types of standard things?
Yeah, absolutely. So yeah, you don't want to operate heavy machinery, including a vehicle, afterwards, really for the rest of the day. That's, I mean, yeah, it's not advised. It can create nausea, and I know that the clinics and the home program give anti-nausea.
Okay.
That you're also okay, so yeah, so you're also, it's also suggested that you fast.
Okay.
Yeah, just in case, not that the anti-nausea usually works. I worked with one guy who, no matter how much anti-nausea he had, he just threw up every time. So I don't know.
Depending on the person, then I guess, who's sensitive to what. That's
sure.
Interesting. And then do you have to limit your activities then afterwards for the next 24 hours, like no exercise or no running, anything like that? Or there's not really no recommendations?
No. I mean, there's no, you shouldn't do it. It is one of those things where, kind of staying soft and allowing yourself to like really, just do things very gently, it's not required, but it's probably a best practice. So it doesn't mean you can't run.
Okay.
You may not want to run, or you may want to, use that. If you have to, it's okay. You can. You certainly don't have to. And maybe that for you, maybe like pushing hard and like seeing what openings that ketamine can give you actually might facilitate something in your exercise that you didn't see before, or it's really about what is your intent. I think that's, I haven't spoken to that, and one of the most important things about ketamine is, what is your intent before you go into it? What do I want to get out of this? What do I want to learn? And it's not going to be something linear, like, let's just say that, and I know I'm going to get it, or that I can direct it during this ketamine experience. But it opens up new possibilities for gaining the outcome of your intent.
Got it.
Afterward.
And do people remember their whole entire experience, or is this something where it's kind of a foggy memory?
It's pretty, sometimes it can be, it really depends. Some more memorable thing, and on the dose. Are you there?
Yep, yeah, right here. So it can be a little bit foggy, then you were saying?
It can be foggy. It depending on the dose, I think the higher the dose, the harder it is to remember, as much of the experience. And really, it's so swoopy swirly that, and it's more of a sort of vague recollection with these sort of peaks. One of the things a sitter can do, because in the home program, you really want to have a sitter in case you need to go to the restroom. That's really the main reason. Or in case, you need, to call out and say, hey, is everything normal? Because you can kind of get into a sense of like, wow, what's going on here? And just to have the person say, yeah, everything's fine. You're fine. I'm fine. Everything's fine. Yeah. Okay. And that's, yeah.
It's good to have that safety person who you can check in with and you trust to make sure what's reality and what's kind of the effects of the medication. So when you're determining, or when the person's given a dosage, is the dosage consistent for if they're doing that 6 treatments? Or is it something that you try it out, you get a low dose, see how your body responds, and then the next time they're going to give you a little bit more and see how that impacts you? Because I have a friend who did that with MDMA, and it took 3 times for him to really feel the effects of it. So I'm curious with ketamine if it's similar.
Yes. In fact, there is a dose discovery period with the program that the oral home program that I'm familiar with. That absolutely is. They sort of, based on it's a milligrams per kilogram thing. And so they start you out with it definitely, the IV clinic, it was the same way. They start out with a lower dose and sort of ratchet it up. Although there is over the years, there is this the guy who's been doing it for 30 years with oral and intramuscular. He feels like, and I think he just starts there, is that he hits people with a 450 milligram oral dose, which bioavailability is, somewhere between, I think, I don't know, 80 and 120 milligrams. Again, of course, the bioavailability. Anyway, yeah. So, and once you hit that really psychedelic dose, then you stay there.
Okay. And then, and so then you're going through the treatment, and then you said some people can have an effect just after one session.
Yeah.
Now, let's say you're finished doing your course of treatment. Do people typically see that they have lasting effects, or are they still working with you with counseling and therapy to keep working on the skills that they were able to gain with the use of ketamine?
Mm-hmm. And it depends on the person, but there absolutely is. There's just variation, as always, right? Some people got wanted that 3 more times, and some people are sort of in their process and continuing the sort of self-reflective, self-awareness, self-regulation kind of, I don't want to say how do I want to say this? Not journey, but just process that they're continuing to be in. It really depends on, again, what is your intent? Was there a problem you wanted to solve, or is this a part of an ongoing self-care routine of yours? So for people who had a problem to solve, I would say once their ketamine has concluded, it's 2 or 3 follow-up sessions, and off they go.
Wow, that's incredible.
Mm-hmm.
That's really incredible. And this is obviously a legal form of doing this, right?
Oh, it is at this point, the only legal form. Yeah, because I would be totally open to working with people with other psychedelics. I just, it's not legal. So.
Got it. Well, that's wonderful. Is there any other considerations that people should think about if they are interested in doing something like this?
Yeah, I would say the one thing is it's not fun and games. It's really, it's work. Okay. And so you want to be conscientious about it. You want to have intent about it, and you want to have time for it. So you want to give yourself at least that 24 hours after the time that you've had it, or, you're really, I want to say, like, I don't know what a good metaphor is, but it's almost like there's a little bit of pouring something valuable down the drain by not giving yourself time afterward to do integration work, to practice new learnings, that sort of thing.
That makes sense. It's like, why go through the whole process if you're not going to reap the benefits of all of it?
That's right.
Well, that's incredible. And so if someone thinks they're interested in doing something like this, how do they get started?
Oh, goodness. Well, so there's so many ways. I mean, if you're in Tampa, you could contact me, and I could direct you, but I don't provide ketamine. So you could look up ketamine clinics in your area. You could contact, it's called My Ketamine Home or New Life. This is basically the legacy company and the new company. That's the company I work with. I'm not, particularly promoting them. I'm creating their integration programs. So that's my affiliation. Okay. But there's one called Mind Bloom. There are field trip clinics, I think is a big nationwide clinic. And there are doctors in each city who have their own clinics, and they do IV. So really it's ketamine clinics or ketamine assisted psychotherapy is a good way to look it up.
And then they could always get started with it and then find you and work with you virtually,
Oh yeah.
whether, and typically when you are doing it, do you do it through Zoom or some kind of other video platform, or is it through the phone if they're not in Florida or in
Zoom.
your city? You do it through Zoom.
Yeah.
So you can see them and have that face-to-face contact. So,
Yeah.
well, that's wonderful. I mean, it sounds like for people with severe depression, or the treatment resistant form of depression, that's a great way to kind of jumpstart them into a new type of program, new type of existence, all of that.
Mental reset.
Oh, that's
what we like to say. Yeah.
That's wonderful. So if people are interested in contacting you, how would they get a hold of you for learning more about this, or, getting you to be on their team?
Mm-hmm. Yeah, well, so I am Leah at leahbensontherapy.com, or at Leah Benson Therapy, or Leah Benson. You could Leah Benson Coaching or leahbensontherapy.com. Either one will get you to me. And I'm on Instagram and Facebook and LinkedIn, all the social channels.
Yes, where we all this nowadays, right?
Absolutely.
Well, this is wonderful. And any last bits that we didn't talk about regarding ketamine that you can think of that would be useful for people to know about on their journey?
I think we pretty much covered it.
Yeah.
It's a really valuable tool for self-expansion. I can just say that. I mean, it's not only for treatment resistant depression, but really for getting unstuck, for finding that reboot, that reset. So yeah.
That's wonderful. I'm glad that glad it's been around for a long enough time that it's not just a new medication that we're trying out, but something that's almost seemingly repurposed to once they found out how it can be beneficial for people.
That yes. And so, okay, sorry. One last thing and you sort of spoke to it. It's that this stuff is so safe. It is so safe. And being a person who was like a real scaredy cat, to I just am kind of a goody two shoes, little scaredy cat, how to do the right thing. I don't know, drugs,
Yes.
I had really terrible experience, in college with marijuana. And so, so to do it was very frightening. And what I can say is that it is so gentle. I mean, it's intense, but it's very gentle. It is so safe. I mean, that's the one thing I want to really leave with people is how safe this is. And that the stories you've heard about K-holes and horse tranquilizers, it's just nonsense.
That's a good ending.
Yeah.
I'm glad to hear that, because I'm like you. I would be terrified to try something like this.
Mm-hmm.
Drugs have definitely not been in my my daily routine ever. So
right.
Yeah. But I'm great to learn more about this option for mental health. It's so important. It affects all of us. It affects our daily lives, and we have to take care of ourselves mentally. So.
Yeah.
Well, thank you so much again for joining us, Leah. I really appreciate your time on the show and coming back to talk to us about a different topic like this. So thank you again.
Such a pleasure. Thank you.
Wonderful. And thank you all for joining us today. It was such a pleasure to see you, and happy 2022. We'll see you again next weekend. Take care now. Bye.